All right, now we're going to have Dr. Herschler. You can start your presentation. I'm putting up your slideshow now.
So I'm Jeremy Herschler. For those of you who don't know me, I'm an addiction psychiatrist, and I've been practicing for about 30 years. So I've seen all kinds of things happen over my career. And I wear different hats at WVU. I'm the program director of the Addiction Psychiatry Fellowship. And I work with the Center for Integrative Pain Management and treat comorbid pain and addiction and psychiatric disorders. And then I have a clinic in Westover where I see patients with substance use disorders and psychiatric problems. So kind of different hats that I wear. So I thought it would be helpful to talk about emerging drug trends. And, I started my practice in 1997 when I began my fellowship in Baltimore. And Baltimore had the highest homicide rate in the country when I worked there, but it also had a terrible problem with heroin and crack cocaine. And it's just interesting to see over the years, what kind of takes the fore as the most popular substances being used by a community. And there's geographic differences you're going to learn with when I talk, kind of go through the publications that I accessed, that there's geographic differences in what's popular in different parts of the country. And so it's kind of interesting to see what's happening in our area and compare it to the rest of the United States. All right, next slide. So I have no conflict of interest to disclose. Next slide. And so these are the concepts that I'm going to be talking about. And first of all, I'm going to talk about something called the National Drug Early Warning System, which is something developed by NIDA in 2014. And you'll learn kind of how we collect information about emerging drug trends throughout the country and really around the world. And these are the topics, and I'm sorry, Laura, I'm not going to talk about Delta 8 and Delta 10 because there's not stuff published on the National Drug Early Warning System's website about it, so I didn't cover it even though it's relevant to here. So these are the things that I'm going to talk about. So first of all, pills containing fentanyl is a big problem in the Midwest and the West, and so I'm going to talk about that. And then I'm going to talk about psilocybin increasing in availability throughout the country. And then I'm going to talk about xylazine complicating the opioid crisis. I'm going to talk about increased availability of illicit ketamine. I'm going to talk about co-use of alcohol and cannabis. And so, Laura, that was relevant to the case that you brought up. And that's something we're really seeing in younger people quite prevalently now. And then I'm going to talk about what's happening in Asia. So what are the designer drugs that are, kind of being found in Asia? And what does that mean for the future of America? And so these are largely stimulants and hallucinogens, but cathinones, phenylethylamines, tryptamines, and piperazines are all being found in Asia. And then I'm going to talk about the fourth wave of the U.S. overdose crisis and talk about what's happened most recently that's very exciting for us is that overdose deaths are declining. All right, next slide. So what is the National Drug Early Warning System? Well, this is something developed in 2014 by NIDA, and it's centered in Florida now. That's the kind of central hub of the early warning system. And it provides the field with timely, salient, and valuable information about drug trends throughout the country and even around the world. And so there's 16 Sentinel sites that collect information, and they use all kinds of data to get information from, overdose fatality, toxicology screens to drug seizures. There's epidemiology and forensic medicine and toxicology and psychiatric histories and sociology and bioinformatics and even artificial intelligence, all combining to collect information about what's happening with drug trends throughout the country. And then one thing that I really want you guys to do is to access this website, the NDU's website, and subscribe to their newsletter. So they have a newsletter that they will send you emails of to keep you up to date on what's happening with emerging drug trends around the country and even around the world. And also there's publications that they have on their website, which is where I got the data and information that I have for this lecture. And so it's a really interesting website, and thank God that we have this so that we can prepare for what's kind of happening and alert the public, if there's a new trend developing that we need to be aware of, because things change. It's an interesting aspect of the work that we do, that the nature of what's being misused can change over time. Next slide. So here's the 16 Sentinel sites. And so for West Virginia, we've got Washington, D.C. and Kentucky being our closest sites for collecting data on emerging drug trends. And so, but there is a way, if you see something new, to submit information to the NDO's website. But these are the sites that are regularly collecting data. Next slide. All right, so maybe the scariest thing to me and all the things I'm going to talk about is pills containing fentanyl. And so what's happening is that pills like illicit Adderall and Xanax now have fentanyl in them. And so young people are overdosing when they're getting, illicit, like people in college getting Adderall to study and end up exposing themselves to fentanyl because it's within the tablets that they're using. And so it's very concerning that fentanyl has entered the drug supply in this way. And so if you look at the rates of seizures, 10.3% in 2017, and now 49% of seizures in 2023 have fentanyl in the pills. So nearly 50% of the pills have fentanyl. So really scary. And that's not happening in West Virginia, but that's happening out west particularly. And so we really need to be careful about this emerging into our colleges and kids, trying to get stimulants to study better and exposing themselves to fentanyl and overdosing. And so, of course, we need to have a kind of a response to this and think about what is the appropriate response for this alarming concern. And so there are fentanyl test strips that can be used to test substances. And so we really need to have people kind of making use of that. But it's very scary that someone would be getting Adderall and end up exposing themselves to something that they could overdose and die from. And this guy, Palomar, he's a researcher with the NDO's website. And he actually was somebody who had lived experience with substance use disorder and now has been researching kind of emerging drug trends for the past 20 years. And so a lot of the publications that I'm going to review come from him. Next slide. All right, so next is psilocybin. And what's happening with psilocybin or mushrooms is that it's gaining acceptance in therapeutic settings. And there's media coverage about, this is wonderful. People at the end of their life, if they're dying of cancer, that they'll relax and not fear death. And maybe you can treat PTSD with it or depression with it. And so it gets this permissive kind of culture around the use of psilocybin. But if people are using this for psychiatric purposes, they're going to take it maybe once a year. Whereas somebody who's using it for recreational purposes may be using it every 2 weeks or once a month, but much more frequently. And so the harms are going to be much more significant in people recreationally using psilocybin, which is a hallucinogen, and you can get persisting hallucinations and people can get really serious sequelae from kind of chronic use of psilocybin. And so also psilocybin has been decriminalized throughout the United States. And so possession now no longer has much of a consequence criminally. And so if you look at the seizures in 2017, there were 402 seizures. And in 2022, there were 1,396. So a big jump in the amount of seizures of psilocybin. And it's mostly in the Midwest and the West. So 36% in the Midwest, 33% in the West. So maybe not affecting West Virginia quite as much yet, but this is what's going on in the country. And so it's suggesting that availability is escalating. And so we have to think about how to prevent harms and help people kind of be aware of the risk of chronic use of these kind of substances, even though it may have a medical benefit for rare use in people that are monitored closely. Next slide. All right, so you guys have heard about xylazine. Xylazine is complicating the opioid crisis. They call it trank dope when people are using the combination of fentanyl adulterated with xylazine. And xylazine is a veterinary tranquilizer. And the way it works is that it binds to alpha-2 receptors or noradrenergic norepinephrine receptors, and it's on the presynaptic neuron. So when that binds, the alpha-2 receptor is bound, it decreases the release of norepinephrine into the system. And so norepinephrine is like your flight or fight hormone. You know, it's a neurotransmitter that makes people excited and energetic, and so it's kind of going to be tranquilizing by blocking that effect. And so you know, it causes kind of sedation and analgesia and muscle relaxation. But the reason why people are combining it with fentanyl is because it's believed to prolong the effects of opioids. And so when I was working in Baltimore many years ago, people would take clonidine, which is also an alpha-2 agonist medication, and that they would use that in combination with heroin or with methadone. So they were combining it with opioids way back then. So this is not a new science being utilized by the drug abusing community. This is something that we've known for a long time. But xylazine has some bad trouble kind of associated with it. And first of all, there's a withdrawal syndrome. So people get irritable and anxious and restless and dysphoric. So they get an unpleasant mood that happens 6 to 12 hours after the last use. And it rarely causes death on its own, but exposure to xylazine with fentanyl has a prolonged sedation. And so if somebody uses Narcan to correct an overdose of somebody who's used fentanyl, they don't wake up because they're still under the effects of xylazine. And as a result, there's been a higher overdose death rate in the combination of fentanyl and xylazine. And people were kind of unsure about, do we just wait and see if these people, respond? And of course, when you give somebody who's a fentanyl overdose Narcan, sometimes they wake up and then they fall back into an intoxicated and overdose state, and you have to give them a second Narcan. And so if somebody's on xylazine, you're not going to know if they've woken up from the, it's kind of unclear what's happening with the effects of Narcan. So it's more complicated in that way. And then also there are wounds associated with xylazine, and it doesn't have to be used IV to get the wounds. So no matter how people are using xylazine, they can get wounds leading to necrosis or actual breakdown of the tissue and secondary infections. They get cellulitis or skin infections and deep space infections below the skin, and even osteomyelitis, which is bone infections from xylazine. So these infections are really serious kind of consequences of people using fentanyl and xylazine. And so how widespread is this? Well, the most recent article that I could find said they found fentanyl xylazine combinations in 48 states, so virtually everywhere. So this is something we're facing throughout the country, and we need good strategy to deal with this and help people manage their infections and safely deal with overdoses and get people the help that they need. Next slide, please. Yeah, you went backward. All right, so also the availability of illicit ketamine has increased. And so ketamine is another one of these drugs that has a medical purpose to it now. We're using S-ketamine or the enantiomer of ketamine to treat treatment-resistant depression. And so that gets into the media and people think, oh, this is medically safe. I can use this as a recreational drug and it's not going to cause harms. And we've used ketamine medically for over a half a century. They use it in pain syndromes for neuropathic pain and as an anesthetic. So we've had it around for a long time, but now off-label use of ketamine in both enantiomers, so these two different kind of structures of ketamine combined is now common. And so the question is the extensive media coverage doing a disservice to patients who have addictions? We really need to think about how we kind of frame people's use of these drugs that we're using medically. Are they safe for people to be using recreationally? And so, looking at the seizures, the highest number of seizures were reported in Tennessee, Florida, and California. And the greatest weight was seized in Tennessee with 844.1 kilograms. So remember, 2.2 pounds per kilogram. And then Pennsylvania had 154.3 kilograms, New York 132.6. And the number of seizures in the US increased from 55 in 2017 to 247 in 2022. So we're definitely seeing a rise in ketamine use throughout the country. And so it's all over, from California to Florida to Pennsylvania, it's everywhere. So we got to be careful about what we're saying in the media about these medications that we're using that have illicit kind of purposes to them. All right, next slide. All right, so getting to Laura's case, so cannabis combined with alcohol is becoming more and more prevalent. And so first of all, legalization of cannabis has increased the availability of cannabis throughout the country. And so again, it's that permissive attitude about a habit-forming drug that is argued to have a medical value to people. I think that maybe the policy has outpaced science here. And so do we really know how good this is as a medical kind of, tool for us to use? And, of course, there's not much of a dose-response relationship when people are using, cannabis to treat medical problems. So it's kind of an unusual sort of thing to be using medically. But in all of this kind of culture around cannabis, the co-use of alcohol and cannabis is really increasing dramatically. And so particularly among young adults. And so what happens with this is you get more impairment. So more performance impairment, driving is worse, cognition is worse, psychosis is more likely, and higher consumption levels are occurring and worse clinical outcomes. So this is another kind of argument that we've got to think about what we're saying to the public about a drug that has harmful effects, that we're saying, hey, this has a medical value. And, I think what we've got to really think about how we frame this to the public. Next slide. All right, so how do we figure out what's coming to the United States next? And one way to do it is to look at what's happening in Asia. And so in Asia, we're seeing designer drugs being used. And so designer drugs are tough to, how do you schedule them and control them? Because once you schedule one drug, then they just add a side chain to the molecule and it's a different drug. And so it's a constant battle to kind of contain these drugs that are being designed. And so what we're seeing in Asia is all kinds of stimulants. So cathinones, do you guys remember bath salts? So bath salts are cathinones, and phenylethylamines and piperazines. So those are all stimulants. And then tryptamines are hallucinogens. And so these are all on the rise in Asia. And so we know that China supplies all kinds of drugs to Mexico, and then Mexico kind of gets them up to the United States. And so we got to worry about, how are we going to intervene with this designer drug trend that's occurring in Asia? And what's that mean for the United States? It's kind of interesting, huh? All right, next slide, please. All right, so some good news. So first of all, we're going to talk about the waves of overdoses uh, in the United States. And so, of course, with the fentanyl and stimulant overdose deaths have increased 50-fold since 2010, from 0.6 in 2010, or 235 deaths, to 34,429 deaths in 2021. And so, it's just a dramatic, huge increase in overdose deaths from this combination of stimulants and fentanyl. And actually, it's interesting because the population that it's most affecting are ethnic and racial minorities. So African American, Black people, and Native Americans are most affected by this overdose problem occurring with fentanyl and stimulants. And then actually, here's this geographic thing. So in the Northeast, fentanyl tends to be combined with cocaine, whereas in the southern and western states, it's more commonly combined with methamphetamine. Now it's weird. Why? I don't know why there's that geographic difference, or how supplies and availability and who kind of controls that, and why would there be such differences geographically and what's happening with the overdose death rates? But that's what's happening. And so there's been 4 waves of overdose deaths. And so the first wave was in the early 2000s with prescription opioids. And then after that, in 2010, we had the overdose deaths from heroin taking the 4. And then around 2013, there was a big jump in fentanyl overdoses, and that was the 3rd wave. And then the 4th wave was this fentanyl overdoses combined with stimulants, which began in 2015. So next slide, please. So here's kind of the picture of these 4 overdose rates with the different waves that we see. And so the green wave, the green line is the prescription opioids, and the purple line is the heroin overdoses. But when you get into the blue and red, the blue being the fentanyl overdoses, and the red being the fentanyl combined with stimulants, what a huge jump that's been in overdoses with those drugs. Just a tremendous increase in overdoses. And so next slide. And so actually, finally, in 2023, around the country, we had a decrease of 3% of the overdose death rate around the country. And so they went from 111,029 deaths in 2022 to 107,543 in 2023. So finally, a decrease around the country. And this is the first annual decrease in drug overdose deaths since 2018. So we finally maybe are making a dent on this. And so what is happening? Have we exhausted the people who are using these substances? And so there's just fewer deaths for that reason? Is legalization of marijuana, is that playing a role? Whoops, you're way ahead of me here. Okay, so is marijuana legalization playing a role in overdose deaths? Is the availability of treatment and overdose rescue kits playing a role? So it's hard to kind of ascertain what's had the biggest impact. But thank God we've finally been able to decrease the trend a little bit. All right, next slide. So West Virginia overdose deaths showed improvement earlier. So in March of 2021 to March of 2022, we were one of 6 states with improvement in decreasing the percentage of overdose deaths. And so from 21 to 22, we had a 4% decrease. And from 22 to 23, we'd had an 11% decrease. But actually, we're still the worst state in the country. And what happened is from 2019 to 2020, we had a 54% spike in deaths with that fentanyl overdose rate going so high. And so that's what made us the worst state in the country. But we're finally kind of having an impact on this. And so next slide, please. And so these are the 6 states that showed, the blue states are the states that actually showed improvements in the overdose death rate. And that kind of solo state out west is Nebraska. But you can see the whole cluster of states around where we are: Ohio, Pennsylvania, Maryland, Delaware, West Virginia, and Virginia, all kind of showing improvement in the overdose death rate. So we've done good work. We're moving in the right direction. But we really need to kind of be prepared for what's coming down the pike. What are we going to see next? Is Asia going to have a big impact on what's happening in West Virginia? And what about the other parts of the country? Are we going to see pills with fentanyl, Adderall and Xanax with fentanyl affecting college students here? Or young people in general who use those kind of things. So we got to be prepared for what's happening. And so please get on the NDO's website and get your email address on that newsletter so that you can get that newsletter sent to you so you can see what's happening and be aware of what's going on in the country. Next slide. And so here's my references. Anybody have questions about this? It's kind of interesting phenomena, huh? What do you guys think?
This was so helpful, Dr. Herschler. I mean, this was just super helpful to me. It's the kind of thing I should be reading about and get, understanding, but just to get it so encapsulated there. And I already signed up for the newsletter while we were talking, so that's really great. A couple of thoughts occurred to me. One is with regard to psilocybin. I've heard of people now doing what they call microdosing. So it's just a small daily amount on their own. And it's so interesting because it is driven by that, what's out there about the studies that are occurring, showing some benefits. So people think, okay, well, if I just do a little bit. So that's just a comment. And then I didn't know that much about xylazine, and I'm seeing it a lot now in our urine confirmations. And I just thought it was a more potent opioid. And so I learned a lot from what you just said that is really helpful. I'm trying to think back. It seems like I've seen some urines with xylazine without fentanyl or opioids. So could it be a marker for is it going to give you a high on its own? It doesn't sound like it.
Well, so some people abuse clonidine, which is a medication that we've had for a long time. And so it is calming. I can use clonidine as an anti-anxiety medication in patients who have anxiety disorders. And so it is calming, it's sedating and tranquilizing a little bit. So people may like it for that reason. But the big thing that's happening is combining it with opioids because it prolongs the effect of the opioids.
Right. Okay, that was really helpful. Thank you so much.
You're welcome. I was really glad that I found that NDO's website. So one thing I suggest, I don't know if you guys read textbooks much, but I've developed a strategy for how to read textbooks. I've been practicing for 30 years. So I know most of the stuff that's in a textbook on substance use disorders, but I've learned to read the index in the back of the book and go through the index and look for things that I don't know about and read about those things. And that was the way that I found the NDO's website, as I was reading the index of the Principles of Addiction Medicine by ASAM, because there's no way I'm going to read that whole textbook. But if you look at the index, you can find, interesting things to read about and learn that may be kind of lacunae in your knowledge base.
Anybody else have any feedback? Is this something you've seen in any of your clinics? What's the most common thing that you guys have seen?
I have another question. I hesitate to ask it because it sounds so ill-informed, but that's why we have ECHO, right? So this phenomenon of pills laced with fentanyl, So these are, I guess my question is about supply. So these are sort of manufactured outside the pharmaceutical industry to market to people, you know, so to speak, on the street. It's like
Right.
sort of non-legitimate Adderall and Xanax. Is that right?
Correct, yes. But young people, may be thinking I need to enhance my cognition, like a nootropic so that I can do better in school. And then they're going to overdose on fentanyl because it's in their Adderall that they
Right,
purchased, from a friend.
right. Gosh, there's so much to learn.
Scary.
Yeah, sometimes the pill that they're buying doesn't even contain any of the substance that they're originally buying it for, such as Adderall. It's just pressed fentanyl.
And you talk about college kids with those. So is that who I can't remember now with the statistics you showed, but is that what who the major users of those are, or is that just an example of somebody who's using? You know what I'm saying?
That's my experience, working in a university setting, that I'm seeing young people who are dabbling in those sort of things for, to enhance their college performance.
Right.
But I think anybody in all walks of life may be potentially someone who could misuse those. So I think in the population that I'm working with, because I'm in a university town, it's more likely that I'm going to see that sort of thing. But if 50% of the pills were cut with fentanyl, that's a half of the pills. Crazy, huh?
Anyone else have anything they want to add or ask?
I had a quick question. You mentioned the trends. We kind of look towards Asia to kind of determine what we might see here in America. What kind of time frame does it take for the trends from Asia to end up here in America?
I do not know. So I'm not qualified to answer that question. It's an interesting question, though. Is this something that happens 10 years later, or is there a big rise and then they say, wow, we can make a ton of money, and they start shipping it to Mexico? And I don't really know what are the factors that determine that. That's kind of how we got fentanyl here, though, right? So fentanyl was manufactured in China and shipped to Mexico and got into our drug supply. And so you can see that process has happened before, which is why I'm thinking Asia.
Do you have anything else you'd like to discuss, Dr. Herschler?
I don't think so. I just hope everybody gets on that website and registers for the newsletter, and keep your eye on the publications that are coming out about emerging trends so we can be prepared. And if we don't have the answers, to start looking around for what are the answers for these kind of problems that we're going to be facing, because this is what our patients are going to be dealing with. So you might as well kind of have some foresight and anticipate what we're going to be facing.
All right. Well, I want to thank you for your time today and for joining us, yourself and for everyone else that had joined on today's session. It's good to have everyone. Our next session is going to be June 24th with Katie Downs presenting on therapy overview. So I'll see everyone in 2 weeks.
Thank you.
Bye.